When someone is first diagnosed with functional neurological disorder, better known as FND, most of the time, the first resource medical providers will offer is a form of psychological therapy. And most of the time, that therapy is going to be cognitive behavioral therapy, better known as CBT. And look, I think CBT is an awesome resource for so many people. I really, really do. However, it is not the only resource FND warriors need on their healing journeys. And I'm saying this as someone who lives with FND and as someone who advocates for others that have been diagnosed with FND. I have personally seen CBT and other psychological therapies do incredible things for FND warriors. I have also seen some cases where it has done absolutely nothing. And that's because FND is not a one-size-fits-all disorder. So what works for me may not work for another person diagnosed with FND. FND impacts the nervous system and the brain, and it can cause symptoms like seizures, speech impairment, blurred vision, mobility loss, tics, tremors, fatigue, and so many other types of symptoms. Symptoms are going to vary FND warrior to FND warrior, and yet most medical providers will say something like psychological therapy is the answer, stop there, and send you on your way. And look, I'm incredibly grateful for the fact that the American Academy of Neurology has recognized CBT as a resource that can help people that live with FND. But what's missing is the equal emphasis on other evidence-based supports. So things like physical therapy, speech therapy, occupational therapy, nervous system regulation, trauma-informed therapy, and other multidisciplinary treatment plans. If FND is going to be recognized as a neurological disorder, which it is, then it must also be recognized that people living with FND need individualized, comprehensive care. There is no cure for FND, but healing, improvement, and even remission are possible when people are given the right combination of resources. So please, stop telling people with FND that CBT or trauma therapy is the only option. It's not true, it's harmful, and it prevents people from getting the care they actually need. People living with FND deserve better than just a single checkbox treatment.